Okay, so let me first talk about, I've talked about a little bit of why outcome measures are important, why an integrated approach is important. Let me talk a little bit about how else they can be very much contribute from the standpoint of problems within the rehabilitation system. And when I say rehab system, certainly the private rehab system when it comes to motor vehicle accident rehab, certainly true within the workers' compensation, WSIB scheme. It's even true in terms of long-term disability. It's a general problem, I think, that occurs. In part, it's occurred in Canada, in Ontario, because we don't have what's called case managers, which is kind of a designated professional to always be there and basically facilitate the whole rehabilitation process for somebody to understand when they go from one phase to the next, understand in terms of the change of resources that are really necessary given a certain rehab goal or rehab phase. I want to talk about the problems with respect to poor outcome measures in the midst of and at the end of treatment stages. Talk about how patient progress is not transparent, and we need to make it more transparent, if only that we want to be able to convince funding sources that it makes sense to continue the funding process. I want to talk about the loss of rehab gains that happens between the transition as one goes, say, from acute rehab into community rehab into more vocational types of circles, or as we go from physical to psychological, or psychological to more cognitively oriented rehab, as well as the disruption of having to send these claimants to these third-party examinations, which are extremely stressful, and which by doing that, really, there's an issue around how well qualified these folks are and whether they are biased because they're paid basically by insurance companies, and some folks actually have predominantly a insurance-based practice. So there can be some concerns along those lines, basically having folks not be provided with benefits because potentially biased insurer examiner has cut them off of treatment or cut them off of income replacement benefits. And the issues in terms of minimal or very late vocational rehabilitation provision, all of these things occur.